Chapter 10, Gonorrhea, its social aspects and prevention. Gonorrhea is an acute infectious disease caused by the gonococcus. Its usual manifestation is a local inflammation of the infected surface. This inflammation is characterized primarily by redness, swelling, and exudation of pus. It extends by direct continuity and rarely by entrance of the gonococcus into the circulation. Thus, gonorrhea is usually a local inflammation, rarely a general infection. The usual portal of infection in the male is the urethra. In the female, the vulva or the urethra. The disease is usually transmitted by sexual intercourse. Indirect transmission to adults by means of clothing, etc., infected with gonorrheal pus is extremely rare, both because of the relative immunity to gonorrhea of the skin and the mouth, the only surfaces with which such articles are likely to come in contact, and also because the coccyx perishes as soon as the secretion containing it dries. Infants and young children are infinitely more susceptible than adults to gonorrhea. Indirect transmission of the disease is a frequent cause of gonorrheal vulvovaginitis in little girls. I have seen but one instance of indirect transmission in the adult male. The only other part of the body likely to be infected with gonorrhea is the ocular conjunctiva. The well-known frequency of gonorrheal conjunctivitis neonatorum is evidence of this susceptibility in infants, but the relative infrequency of gonorrheal conjunctivitis in later life is best explained by the theory that the conjunctiva of the adult has lost its excessive sensitiveness to the gonococcus. How else explain the fact that among the innumerable filthy gonorrheics who throng our venereal clinics, conjunctivitis is almost an unknown complication? It is not conceivable that their immunity is due either to the cleanliness of their hands or to the fact that these dirty hands keep away from their eyes. That an adult eye is occasionally inoculated only increases our wonder that more are not. Genitals and eyes apart, the human integument is almost immune to gonorrhea. The rectum may be inoculated by sodomy, or, in the female, by drippings from the inflamed vulva. A very few instances attest the fact that the skin and the buccal and nasal mucous membranes may be inoculated. The importance of gonorrhea to the community rests chiefly upon four factors. First, its transmissibility by sexual intercourse. Second, its rebelliousness to treatment, its capacity to extend to the uttermost parts of the urinary and genital mucous membranes, and its involvement, no less terrible for being rare, of the whole economy in gonococcus septicemia. Third, its chronicity and latency, which deceive the patient and even his physician into the belief that the disease is cured until a new outbreak in the patient himself, or infection of a sexual partner, or, if the patient be a parturient woman, of the eyes of her child, reveals the inveteracy and virulence of the disease. Fourth, the ease with which female children are indirectly contaminated and the hospital and family epidemics resulting therefrom.